We are focusing on hepatic coma by me, Francis Lufupa from Pex Minds Online Tuition. So let's now look at the introduction of hepatic coma. So the liver is a cardinal body organ responsible for various activities in the body, such as excretion and removal of waste product from the body. So when the liver fails to perform its function of the excretion, waste from the blood, the toxin will accumulate in the blood and are supplied to the various parts of the body, including the brain. When these toxins are transported to the brain in blood, the brain's function starts to decline or fail. When the brain fails to function, the patient will go into coma. So this type of coma is what we call hepatic coma. So let's now look at the definition of hepatic coma. So this is the loss of brain function following failure of the liver to excrete toxins from the blood, and it is characterized by fever and coma. Or you can define it as this is a decline in the brain function occurring as a result of severe liver disease. Okay, so after we've looked at the definition, let's now look at the functions of the liver. So number one, we are saying it helps in the blood detoxification. The number two, excretion of blood, bilirubin. The number three, synthesis of plasma protein. The number four, formation and excretion of bile. The number five, synthesis and storage of clotting factor. The number six, storage of glycogen. The number seven, metabolism of fats, protein and carbohydrate. Number eight, enzyme activation. Number 9, excretion of ammonia. Number 10, storage of blood. So those are the functions of the liver. Let's now look at the causes of hepatic coma. What are the causes of hepatic coma? So the causes, we are saying they are known, but liver failure is the major cause. So there are no specific cause to what is causing hepatic coma. So but there are some risk factors that can predispose one to have hepatic coma. So number one, we are saying trauma. So this may rupture the liver blood vessels, making it fails to function and perform. Then number two, we are saying age. This can be due to degeneration of cells in the liver because of old age, which will result in weakening it. Then number three, tissue necrosis. So this may cause inability of hepatocyte to perform its function, hence causing hepatic coma. Then number four, we are saying chronic liver disease. So condition like liver cirrhosis damages the liver severely, causing failure of the liver to work. Then number five, we are saying infections of the liver. So this causes inflammation and eventually formation of abscess that alters the normal liver function. So those are the risk factors that predispose one to have hepatic coma. So we said trauma, age, tissue necrosis, chronic liver disease, infection of the liver. Yes. Then let's now look at the types of hepatic coma. So the types of hepatic coma, they are divided into two. We are saying hepatocellular hepatic coma. So this type occurs as a result of severe damage to significant part of the hepatic cells in viral hepatitis. Then other causes includes intoxication with chemical poisoning and following fungal infection. So that is hepatocellular hepatic coma. Then the second type, we are saying shanty hepatic coma. So this is also called bypass hepatic coma. So this occurs when outflow of blood from the intestine passes not through the liver. So it bypasses the liver. The outflow of blood bypasses the liver. So this causes liver ischemia leading to tissue necrosis. So those are the two major types of hepatic coma. So let's now look at the pathophysiology. So the liver is responsible for excretion of the waste product from the blood like urea, ammonia, and creatinine. So following excessive alcohol intake, the liver is damaged and eventually fails to excrete waste product from the blood. So the waste product accumulate in the blood and are transported to the brain, causing brain toxification. So symptoms like confusion, headache, jaundice, hallucination occurs, and eventually the brain fails to function and coma occurs. Yes, so that is what happened for a person to develop hepatic coma. Let's now look at the signs and symptoms. So the signs and symptoms one will present with is fever related to the infection. The number two, jaundice related to failure of unconjugated bilirubin excretion. The number three, we are saying ascites related to excess protein insufficiency. Then number 4, we are saying confusion related to brain intoxication. Then number 5, we're saying headache related to cerebral hypoxia. Then number 6, we're saying hallucination related to cerebral hypoxia. Then bleeding tendencies related to insufficient blood clotting factor. Then number 8, we're saying um, weakness related to glucose insufficient. Then number 9, we're saying severe abdominal pain related to liver overactivities. Then number 10, we're saying tremors related to excess toxins in the blood. Yes. Let's now look at the management of hepatic coma. So first thing we are going to look at is investigation stroke diagnosis. So we are going to do history taking. This will reveal risks such as prolonged and excessive alcohol intake. Yes. Then number 2, we are going to do physical exam. This will show some symptoms like jaundice, ascites, pain when palpating the liver, etc. Yes. Then other investigation that we are going to do, liver function test. The liver function test may show raised enzyme level signifying stress of the liver. Then number 4, we are saying complete blood count or full blood count. This will show raised leukocytes levels. The red blood cells may be reduced to including the clotting factor. Then we are going to do magnetic resonance imaging or CT scan, computed tomograph scan. This will show change in the counter and size of the liver. Is it clear? Then let's now look at the treatment. So first thing, we are going to give oxygen therapy in cases of breathing difficulties. Then number 2, we are going to give antibiotics such as gentamicin and benzopenicillin intravenously to treat the infection. Then number 3, we are going to give lactose. This enables the liver to rest. Then 4, liver transplant. Then number 5, we are going to do blood transfusion in cases of severe anemia. Then we are going to give diet. So yes, to reduce on excessive protein intake and fats intake, then increase carbohydrate intake. Then we are also going to give analgesia IV to relieve pain. Is it clear? So how can you prevent this hepatic coma? So number 1, avoid excess alcohol intake. Then number 2, avoid and reduce on excess fat intake. Then number 3, maintain a good weight. Then number 4, vaccination against hepatitis. Then number 5, early treatment and diagnosis of liver disease. So those are the preventive measures, and that is our presentation on hepatic coma. That is our presentation on hepatic coma. So for more information, you can follow us on YouTube, Pex Minds Online Tuition. Pex Minds on YouTube. Yes. Bye bye.